All right, good morning. We are live. This is Public Health and Minority Health Disparities Subcommittee. We are meeting today. We have 5 bills, 3 which I think are ready, 2 which we're going to talk about and see where we are. As this is crossover week, I'm going to ask everyone to be patient and also be diligent about checking your emails, because we will probably have another potential subcommittee later today to attempt to clear the desk, as it were, in preparation for crossover. So we are going to start with House Bill 1083. This is the Maryland Department of Health Work Group to implement early and periodic screening, diagnostic, and treatment requirements. Aaron, if you can walk us through the bill and the amendments and our late breaking news on this bill. Oh, you're on mute.
There is a reprint of the bill that's been provided that incorporates the amendments that have been agreed to by stakeholders and the Department of Health. The amendments provide that the Behavioral Health Advisory Council and the Commission on Behavioral Health Care Treatment and Access, through its work group on youth behavioral health, individuals with disabilities, and individuals with complex behavioral health needs, shall provide recommendations to implement the recommendations in the Centers for Medicare and Medicaid Services State Health Official Letter number 24-005, which are best practices for adhering to early and periodic screening, diagnostic, and treatment requirements for children. And that would include screening and assessment of behavioral health conditions, the feasibility of implementing DC-05 diagnostic classification of mental health and developmental disorders of infancy and early childhood as a diagnostic tool for patients under the age of 5 years, community-based services to correct and ameliorate a wide range of behavioral health conditions, and services to ensure children's behavioral health, address early symptoms of concern with or without a diagnosis, and address urgent and crisis needs. And then in performing those duties, the council and commission through the work group must consult with behavioral health professionals who work with children and families, early childhood mental health specialists, clinicians who work with children and families, children with behavioral health issues, behavioral health advocates, parents and caregivers with experience navigating the behavioral health system on behalf of children, and other interested stakeholders. And the reprint before you provides that on or before November 1st, 2025, the Department of Health will submit a report of their findings and recommendations to the General Assembly.
Thank you. And before I open up for questions, just to clarify, because this had a modest fiscal note, because this is now amended to utilize an existing work group, does that impact the fiscal note?
The department's here, they could speak to that.
I see Secretary Moran, I think, can probably speak to that.
Yes, good morning. Yes, because we're going to be leveraging the BHAC existing work group, it would ameliorate the fiscal note. And also, I just want to thank Ann and other stakeholders for working with the department on all the particular pieces of this bill. I think we got to a good place. So the department's in good shape on this one.
Thank you very much, Secretary Moran, and thank you to everyone for all of your hard work. With that, do I have on the amendments? Oh, go ahead, Aaron.
Secretary Moran, the before the members have a November 1st.
Yes.
And should that be January 1?
Yes, we've agreed on January 1, and then the corresponding sunset, because this is temporary work of this particular work group to coincide with the delivery of that report.
So could you just so the committee knows so the report would be January 1, 2026.
Okay,
yes.
So that's line 17, page 2 of the reprint. Is that right?
Correct. January 1. Yes, 2026 for the report, and then also the work group would sunset, if you will, at that time too.
Yeah, I don't know if I have to write in a sunset or not, since their work would be done. But I'll ask. But I think by virtue of the fact that the work's done, then that just implies that the work group's done.
Okay.
But I'll make sure.
Sounds good.
Thank you very much. And just to clarify for the body, the motion on the amendments is with that change of November 1 to January 1. So with that, do we have a motion on the amendments?
Move the amendments.
Second.
All right,
Second.
they've been moved and seconded. Any further discussion on the amendments? All in favor say aye.
Aye.
Anyone opposed, go ahead and raise your hand in the chat. Seeing none, do I have a motion on the bill as amended?
So moved.
Second.
It's been moved and seconded. Any further discussion on the bill? Thank you, everyone, for all your hard work with that. All in favor say aye. Anyone opposed, go ahead and raise your hand in the chat. All right, 1083 passes unanimously. Thank you so much. All right, next up is 1142. This is Public Health Maryland Interested Parties Advisory Group Establishment. Aaron, if you can talk us through the bill and the amendments. I think we talked about this. Did we talk about this one?
No, we haven't
We
talked
did not
about
talk
it.
about this one yesterday. Okay.
This bill would generally codify the federally required Maryland Interested Parties Advisory Group, also known as IPAG, in the Maryland Department of Health. And it also expands the duty of, Dr. Moran, do you say IPAG?
Yes, I say
That's how
IPAC,
it's-
although I do not like that term either, but IPAC, yes.
I can just call it the internet. But for the interest of time, we'll call it IPAG.
Yeah.
And MDH beyond those requirements. The primary purpose of IPAG is to ensure Medicaid payment rates, this is the bill as introduced, is to ensure Medicaid payment rates are sufficient to provide adequate access to applicable service categories, such as homemaker, home health aide, personal care, and habilitation services, and the existence of an adequate and qualified direct care workforce to provide services in Maryland. By September 1st, 2026, and annually thereafter, IPAG must report on specified issues, including employment standards for direct care workers, removing barriers to access to care, and its review of disparities impacting direct care workers and consumers. There is a reprint of the bill that's been provided. If you look on page 3 of the reprint, line 10, it alters the primary purpose of the advisory group to advise and consult on Medicaid payment rate sufficiency, ensuring adequate access to applicable service categories, and it strikes the requirement, or it strikes the notion that the primary purpose of the group is to ensure the existence of an adequate and qualified direct care workforce to provide services in the state. The amendments also alter the composition of the work group to include the director of Medicaid or their designee, the secretary of labor or their designee, and then members who would be appointed by the deputy secretary of healthcare financing, and it strikes the members, the one representative of a provider organization, the one representative of the general public, and it replaces them with 2 representatives of a provider association, of whom one shall be a representative of an RSA and one shall be a representative of an employer trade association. Moving on to bill page 5, it would provide that the advisory group would meet on an annual basis instead of a quarterly basis. And then there is language that's been struck on bill page 6. The bill provides that the department must provide sufficient data and resources at least 30 days in advance of a meeting to support informed participation in advisory group discussions. And the bills introduced was very specific as to that data that was to be provided. And instead it strikes the specific list and just it requires the department to provide data on current and proposed payment rates, federally required information, including home and community-based services payment transparency reports, other reports under that section, also Bureau of Labor Statistics, publicly available wage data, benchmarking and rate studies for home and community-based services, rate information from neighboring or similarly situated states, and access to care metrics. And then there is more information that is stricken that as to the data that the department has to provide to the advisory group. There is, in the bill is introduced, the department was required to develop a public education and communication plan, and that has been stricken from the bill as well. And then on bill page 8, starting on line 22, the advisory group is required to evaluate the sufficiency of Medicaid payment rates. It strikes language that have required the advisory group to examine working conditions for the direct care workforce. And then on bill page 9, it also strikes the requirement that the advisory group develop a communication plan for the department's engagement with direct care workers. On page 9, it strikes the specific requirements to be included in the report to the General Assembly, and just requires the report to include just their activities and recommendations. Then any recommendations that are adopted by the advisory group must receive a majority vote, and the bill's introduced required an affirmative vote of at least 7 members. And then there is a requirement that the department post that report to their website within 30 days after the report has been finalized.
Thank you, Erin. And I want to thank all of the stakeholders who and the department who have been working diligently with us to find a compromise. Dan, I'm going to call on you in just one second. I just want to frame this up so that the members know the conversations that we had. So one of the compromises you might have heard from the original testimony was the feds required 1 representative of a provider association. We put 2 in the bill, and then after the hearing, there was a request to make sure that we had additional representation. The compromise that we offered was, rather than add a 3rd representative, we actually articulated out that 1 representative would be of a residential service agency, 1 representative would be of an employer trade association. I want to turn to Dana Kaufman, because I believe that you intend to still press for a 3rd, and I want to make sure we have the conversation.
Thank you very much, Delegate Bagnall. Yes, so our issue, and I represent the Maryland National Capital Home Care Association, the whole purpose of this advisory council, and it's very clearly set out in this legislation, is to advise and consult on Medicaid rates. Those rates are paid to the provider community, who are the ones who can also best determine the sufficiency, or at least give information to the advisory committee on the cost challenges and the administrative challenges being a provider. There are 12 individuals on this advisory committee. 5 are with the consumers, 5 are with direct care workers, but only 2 are with the providers. And while I appreciate your amendment, it still shows that we have a very little voice in that, especially when you consider the fact that a report will have recommendations by a simple majority, which, again, I feel like while we're trying to bolster the voices of the direct care workers, we're doing it at the expense of the providers. And we need to have a better partnership, because we already have issues with the provider community and having enough Medicaid providers for this population that is continuing to grow. So my request, given the fact that this is an advisory committee, is to have equal representation and to model the provider representation on the same representation of the consumers and the direct care workers. And I will say that the federal statute, or the federal rule, says that, and I have it here, it does not limit who can be on it. It actually was done just to say that the interested parties advisory group must include, at a minimum, direct care workers, beneficiaries, authorized representatives, and other interested parties impacted by the service rates in question as determined by the state. So there is no limitation on the composition, and there was also no requirement in the federal rule for a simple majority vote. So again, I don't want to belabor, because I know it's getting late, but our request is that there be a 5, 5, and 5.
Thank you. Delegate Hutchinson.
Thank you, Madam Chair. So I'm actually just curious that it is 12 and why we even have an even number if there was coming to a vote and there would be potentially a tie, and why we're not adding more providers to this committee or advisory group.
And is there anyone from the stakeholders community that wants to respond? Because I know there've been a lot of conversations around this. David Rodwin, go ahead.
Thank you. Sure. And just at the outset, want to thank MDH for their, again, collaborative partnership with advocates on hashing out some of the details of this, and Acting Secretary Moran in particular. So that, and as you know, Dana read, the rule doesn't require any provider membership or employer membership. Even one spot. And in the original bill draft, there was one. In this compromise, now there's two. This isn't a kind of advisory group that's going to set policy. I don't anticipate, the structure of it isn't an antagonistic one where different sort of interests are going to, fight it out as to how things should work. It's just about, until this, there has been no forum at all in Maryland to solicit worker voices on this publicly funded Medicaid workforce, and this is the only one. And that's the way that CMS drafted it, and that's the way that it's been done here. Recognizing that providers also are a part of this. They have other ways also of making their voices heard beyond this advisory council. But the purpose of this rule is really to solicit worker voices and consumer voices, and that's why it's drafted that way by CMS. I also, this is the first I've heard that industry is asking for 5. I believe at the hearing there was a request for 3. So I don't in good faith, we've increased it to 2, and it's not intended to be an us versus them situation. It's an advisory council that, as drafted by the feds, centers workers and consumers, and that's the way the bill is drafted as well, to implement that federal requirement.
And I think just to clarify, Dana, am I correct? You're asking for 3 from the provider associations, and then you were speaking to the 2 other consumer organizations. Is that correct?
Yeah, to be clear, my testimony at the hearing was for 3 more. So
For
it
3
would have
more.
been
Oh, I don't think I realized that either.
Oh yeah, so it would have been the 5, 5, and 5. When you get 2 minutes, words get shortened. But yeah, it was the 5, 5, and 5. So it was 3
It was
more.
to make it even, right?
Yes,
what my
to make
note
it
said,
even.
To make it even.
And then that would be 15.
Thank you. Delegate White Holland.
Thank you, Madam Chair. Just very quickly, it seems that because this also is connected to federal guidelines, based on this bill, it sounds like each state is able to kind of configure this advisory group according to their needs and the like. We understand the purpose of it, but I didn't know if there were any other examples from our neighboring states or even from other states that have incorporated our providers or have kind of formed it differently than how it was originally intended. I didn't know if there was any background or insights you have on that.
I don't, because this is a new rule. So we're actually we're actually trying to put ourselves sort of ahead of the
game. Got it.
So we are actually doing this 2 years in advance of the federal requirement, so that we can get the work going. And I think from the rule, the intent was to ensure that we're giving weight to worker voices. Delegate Hutchinson.
Thank you, Madam Chair. Just back to the, again, even numbers versus odd numbers. I would like to make an amendment to the compromise to add 1 more provider and make it a total of 13.
So so that would be 3 representatives of the provider association. So what we have articulated, 1 shall be a representative of a residual service agency, 1 shall be a representative of an employer trade association. You're talking about a 3rd there. Is that correct?
I would actually defer to Dana to what she would, in terms of, I know she's not going to get three, but can we get one more provider?
I would say then it would be two or it would be two from residential service agencies.
And one from, all right,
Mhm.
so Tom, you've made a motion to add an additional residential service agency member. Do we have a second on that motion? Or
Second.
so that we can discuss it? Okay, it's been seconded, it's been moved and seconded. Do we want to open this up for discussion? So this is to amend the amendment, and add one more representative from an RSA. Are there concerns from the stakeholders? Does anyone want to be heard on this? It sounds like this would give us an odd number, so when we have, so we don't have a tie vote potentially, but also would be a compromise to get us to 3 versus the 5. Mr. Rodwin.
Thank you, Delegate Bagnall. I think, just to reiterate the point that it was drafted, by the feds quite intentionally to focus worker voices and consumer voices. And there's a dynamic that I think we can all understand that sometimes happens in spaces like this, where workers whose hourly wage depends on employers and who are maybe not accustomed to speaking up to those, in power, can sometimes wind up having their voices sort of silenced in a way, even if it's not intentionally by employers. The dynamic surfaces, pretty often in a space like this, where there are some folks at the table who have, just to be blunt, more money and power than those who than others. And I think the Biden administration crafted it this way for a reason. And every state has employers as well. And yet it's interesting that there is no employer representation requirement written into the CMS rule. We talked about, in the MDH compromise amendment, there's 2. And now we're talking about adding more. And so the sort of, I think, tenor and even intent of the rule can sort of be chipped away in this way when the overall balance changes. So I think, from the perspective of advocates who all looked at the MDH amendment and came on board with it, the desire is to continue with the MDH amendment. It's hard for me to anticipate a vote that would be so divided that it's 6-6. I mean, we're talking about everyone wants to increase rates here, workers and consumers as well. I don't think there's an antagonistic sort of situation, but the tenor overall can be shifted with the balance. So I think we would ask that the MDH amendment is what the subcommittee adopt. Thank you.
Thank you, Mr. Rodwin. Ms. Kaufman.
And I would just say, we would appreciate having the third. I don't think in a advisory council that's going to be run by MDH, you're going to have that type of dynamic that Mr. Rodwin is concerned about. I think it is a controlled environment, and you still have the 5 consumers and the 5 direct care workers. So I just think that the providers will bring very good information about the challenges of being a Medicaid provider, and that will help with the overall discussion. And again, the feds, we have the ability, and the federal rule gave us, the states, the ability to adjust as necessary.
Thank you, Ms. Kaufman. And I know this is my bill, but I also I'm happy to go by the will of our subcommittee. And I just saw a hand from Delegate Alston.
Thank you. I was just going to say, we definitely need to hear more from providers, not just on this bill, but in general, because I have a very good friend who has one of these businesses and they stopped taking Medicaid. So I think it's important that we have more provider input. And I agree that the department should be able to control the tenor and nature of the conversation. So I would support the amendment.
Okay. Thank you, Delegate Alston. So we do have a motion on the amendment to the amendment. So is there any further discussion? This is just on whether we are going to add an additional representative of a residential service agency. All in favor of adding an additional member, say aye. I'm not going to vote on this one because I'm going to abstain because it's my bill. Anyone opposed, go ahead and raise your hand in the chat. Okay, so that the amendment carries. We're going to add one representative of a residential service agency to the work group. We have the department here, and we have Mr. Rodwin, who I am confident will ensure that we will make sure that all of our worker voices are heard. And now, do I have a motion on the amended amendments?
Move the amended amendments.
I'll second.
All right, it's been moved and seconded. Any further discussion on the amendments? All right. Ms. Kaufman, make sure you go back and tell your folks that you did a good job. You didn't get to 5, but we got to 3. And we're going to make sure that everyone is adequately represented and heard. And we're going to be 2 years ahead of the rest of the country. So it's been moved and seconded. All in favor, say aye. Oh, sorry. Any further discussion? All right. All in favor, say aye. Anyone opposed, go ahead and raise your hand up. Delegate Chisholm, are you opposed or you had a question?
I'm just opposed for now because of the fiscal note. That fiscal note's still there, right?
That's what I was going to see if could Dr. Moran state as to his opinion of the fiscal note with the amendments.
The fiscal note with the revisions, the significant revisions that we discussed, cleared the fiscal note. So there's no fiscal note.
All right, I'm a yes.
All right, thank you. Thank you for clarifying that. I forgot to address that. So the motion carries unanimously. Thank you, everyone. That is House Bill. Oh my gosh, I just lost it. Okay, House Bill 1442. We're going to turn to 1142. Sorry, 1143. All right, and we're 9:30, so we're doing well. Aaron, if you can go ahead and talk us through the bill and the amendments.
The bill as introduced would have authorized a licensed dental hygienist to practice under the general supervision of a licensed dentist in a school or school-based health center if the dental hygienist submits a statement of their intent to do so to the State Board of Dental Examiners. The bill also establishes a Maryland collaborative to improve children's oral health through school-based programs to be staffed by MDH. Members of the collaborative must submit to the Governor and General Assembly an interim report of their findings by December 1st, 2025, and a final report by October 1st, 2026. The provisions related to the collaborative would terminate on June 30th, 2027. There are 2 amendments that have been provided that are being offered by Delegate Bagnall. The one amendment would add to the collaborative a representative of the Maryland State Dental Society and a representative of the State Board of Dental Examiners. There is another amendment that would strike the provision in the bill that would have authorized a dental hygienist to practice dental hygiene under general supervision in a school-based health center. So that provision of the bill is struck. Their amendment also would add to the study that's being performed by the collaborative for them to clarify the law governing the practice of dental hygienists in school settings to reduce confusion among practitioners and school-based programs.
Thank you, Aaron. Just for the membership, this is about, we're already allowed to do it. We're already authorized to have dentists and dental hygienists offering oral health services in schools, but we need to figure out how to do it better. So with that, is there anyone who wants to be heard on this bill? Okay, do I have a motion? Robin Elliott.
I just wanted to say thank you on the behalf of the Maryland Dental Action Coalition.
Thank you.
Thank you very much. Do I have a motion on the amendments?
Move the amendments.
Second.
Yep. It's been moved and seconded. Any further discussion on the amendments? All in favor say aye. Anyone opposed to the amendments, go ahead and raise your hand in the chat. Seeing none, do I have a motion on the bill as amended?
Move the bill as amended.
Do I have a second?
Second.
All right, it's been moved and seconded. Any further discussion on the bill as amended? All right, all in favor say aye. Anyone opposed, go ahead and raise your hand in the chat. All right, we pass unanimously. Thank you, everyone. So now we're going to turn to some discussions and try and figure out where we are. First up is House Bill 386. This is pesticides, PFAS, chemicals prohibitions. Actually, let me start with 290 because I'm this one I think we were close, and I want to find out how close. Office of the Chief Medical Examiner, disclosure of autopsy information and maintenance of investigative database. But I heard there were some amendments floating, and I did, but I'm not cognizant of what they are. So, who is prepared to speak on this bill as to where we are? I see.
I can kick it off. This is Sarah.
Thanks,
So
Sarah.
we did from the Department of Health. I do think we are close. The department sent some updated amendments just before this subcommittee meeting. My apologies for the timing, but we were diligently working last night on this. After discussing with Delegate Hill as well. We're very close. I think we have consensus language regarding data use agreement pieces. We just have one sticking point with regard to one of the pieces of the autopsy diagnosis piece. I can go over each of the amendments kind of one by one, but that is the one piece where we have not reached consensus on that specific line. And I'll pause here in case Dr. Kalyana Raman wants to add anything on that piece.
No, I'm good right now, but I'm sure there'll be questions.
And I also see Rebecca Snyder in the meeting as well from
Yes, I'm here. And so what Sarah's saying is in fact the case. We are at consensus on many of the amendments. I just sent, I think, after 9. Sarah had sent over sort of the wording that MDH would prefer for number 6. So essentially, what these consensus amendments would do would create a situation where any member of the public sort of just could go up and ask for the final autopsy diagnosis, which would include elements such as, name of decedent, cause of death, those types of things. And then they would have the cause and manner of death, and then the medical opinions. This number 6 is what's in dispute, the medical opinion and the facts informing such conclusions. The press feels like it should be, rather than medical opinion of the facts informing such conclusions, which doesn't really make a lot of sense to us. We feel like it should be medical opinion and the facts informing such conclusions. We're okay to shift that back to be the facts related to the diagnosis, since we understand that the concern is that unrelated information is not put into this kind of first level request. Does that make sense to everyone? I felt like I was rambling.
No, I think we're following. I saw a hand from Delegate Hill, and then I'll make a comment.
No, I'm good. I just wanted to, and Rebecca just went over exactly where they are right now, and except that Rebecca said they could go back to that other word. Sarah, does that fix it for you?
And I see a hand from Dr. Kalyana Raman. So we might have an answer.
Yeah, I think the issue with and the facts is that we need to have a standardized autopsy report, and the facts are going to be different for each case. We cannot standardize autopsy reports and have, depending on the condition, different facts showing up in an autopsy report.
And I think Rebecca's changed it from "and" to you had a different word you just said, Rebecca?
Actually, I'm sorry, the medical examiner had "of," we want "and."
So
And I think that's the issue at the end, is that we wouldn't then have a standardized autopsy
have a
report.
standardized.
So otherwise, if everything's all together, maybe I can move with the "and." Move the amendments with the "and."
Second.
I mean, no, with the medical,
Of.
what MDH wants,
With the
with the "of."
Thank you.
Okay.
So do we need a little more time?
Yes.
Can we try and have our amendments, our language by 2:00 today?
I think we can do that.
And work it out by 2:00? All right. Like I said, check your emails. Delegate Alston, do you want to make final comments and then we're gonna move on because we're gonna reconvene later today.
We can move on. I'll just say on this bill, I think we need as much transparency as possible with these autopsies, because it's through autopsies that we're able to determine what, if anything, may be wrong in our society. And listening to this bill, I'm thinking of Emmett Till. If we didn't have those photos and that information, we would have never had the full story of what happened to that person. George Floyd, we wouldn't have the full story. So we need to know what's happening. And I am going to resist any mechanisms that's going to prevent the press from getting information that will help inform the public, especially when we have the government that is sanctioning or supporting bad actions against our citizens. We need to know when that's happening. And it's through autopsies that we're able to find out this information. So thank you for allowing me to speak on it.
Madam
And
Chair.
I appreciate that, Delegate Alston. I just let me go to Delegate Hill.
Okay, thank you. I just was going to suggest to that point, because there have been things that have worked out, and I think a lot of the transparency has been agreed upon, that I would ask that Sarah, Rebecca, send to the chair and council the amendments that you have, so that the whole committee can see what you've already worked out, because I think I think a lot of that has been addressed, and the one word is
Yeah,
not the
I
transparency.
think that's a good idea, Delegate Hill, because we could vote on the amendments and not vote the bill till it's completely worked out, but we don't have them in front of us, and I don't
And
want to
I've
ask
seen
anyone
them.
yeah.
And I was just going to ask, I know yesterday I mentioned the ACLU, and I don't know if anybody has spoken with them or if they've engaged. And if they have not ignored the request, then that's one thing. But if we haven't reached out to them, then I think we need to do that.
And Delegate Alston, I will apologize. I'm not sure that we did reach out. We reached out yesterday because, as you know, we were in meetings till 10:00. But I do see a hand from Dr. Kalyana Raman, and then Ms. Johnson.
Yeah, so Delegate Olson, we heard about the concerns from the ACLU. We're happy to meet. We just don't know what they are yet, and we were waiting to get them and get a contact. So if Ms. Johnson is a contact, we can reach out and have that conversation.
Ms. Johnson, go ahead.
Yes, and I'm sorry I'm not on camera at the moment, but yes, I am the contact here on behalf of the ACLU of Maryland. And so we did just receive a copy of the proposed amendments, just as Rebecca mentioned this morning. So we'll follow up and make sure to confirm our alignment prior to the 2 p.m. deadline.
Thank you very much. And I will admit I haven't looked at the committee schedule, but we're going to go with 2 now until Michelle tells me no.
Well, we're doing subcommittees all afternoon, so we'll fit it in where we can.
Fantastic. All right. Thank you, Erin. Thank you for the confirmation. All right. We're going to hold 290 there. I do want to have a conversation on House Bill 386. We know that we have requested amendments, but we do not have them yet. We know that these are not these are not consensus amendments. I'm going to be very honest with the committee. There has been a lot of work and a lot of meetings. So I want to give Delegate Hutchinson, Delegate Hill, and Delegate Warman an opportunity to talk about the work that has been done. And then when we reconvene, we will hopefully have the amendments and we can see where we are. So Delegate Hutchinson, I see you've already unmuted. Delegate Hill, Delegate Warman, feel free to talk about where we are.
Thank you, Madam Chair. So it has been a very long process. We've had multiple meetings on this subject, not necessarily consensus, but a lot of back and forth on what's the best way to move forward, looking at what's being done in other states and also then what is most applicable here for the state of Maryland. There's sort of 3 different amendments that we'll be finalizing here today. One is around what we would say is the definition, but we are calling it more the working scope, and that is using the EPA's definition in terms of the working scope for pesticides. Number 2 is then the implementation date to make that more consistent with the other states, and that is to 2032. And then sort of a late change that we had collectively as the work group yesterday is originally it was waivers, but then we realized that waivers weren't necessary in the ways that the bill was structured. So we changed it to unacceptable risk. And we're looking at some guidance from both MDH and the Department of Ag on this because it would involve them. So we need to come up with a final wording on that. We have 2 different versions of that wording before we go to amendments. I've asked the Department of Ag to review them. I did hear back from Secretary Addix that while they don't have a position on the bill, they do want to look at these amendments and make sure that they are consistent with their current COMAR regulations on what they have authority to in terms of pesticides. So that's where we stand today, and I'll turn it over to Delegate Hill.
Yeah, I think that sort of summarizes, and I did send the proposed language, and again, the only area that it's not consensus. What the members of the subcommittee have decided is where we think the committee should land, and there is some back and forth based on the stakeholders about whether unacceptable risk should be worded as, the Department of Health with the Department of Ag, or the Department of Ag with the Department of Health. That kind of thing. And I see with Ryan Moran on today, I don't know if we want to give those 2 or we want to do that offline because I don't know that we've had that conversation. We've had it with the Department of Ag, and we could at least get.
Yeah, I think we should get.
And I think the thought was that because we're talking about health risk as opposed to waivers on use, there are 2 things. Health risk is the Department of Health saying, based on new information or emerging information, however we're wording that, we're concerned that this product that was not on the banned list needs to be on the banned list. And the Department of Ag would have to agree that their banning it would not cause agricultural problem, either say because there is no substitute agreement available to treat particular pesticide or pests that need to be treated, or for some other way. So that's why we had talked about, and again, they'd have equal weight. No one has veto power. They would both have to agree for any product to be put on the list. And there's some concern by some parties about who's listed first. And I think what I tried to do in expressing the members' idea of what the amendment should do is to list it with qualifiers about what they're basing those decisions on. in which case the order doesn't matter, making it clear that it has to be an agreement they have to work in collaboration and agreement to put something on there.
Thank you, Delegate Hill. And we're not asking for the departments to comment yet because they have asked to be able to see the language, and we're still waiting on the amendments. We should have those this morning. Obviously we didn't ask the amendments office to work overnight. I mean, they may have, but we didn't make that ask. So as soon as we have them, we'll make sure to circulate them to the subcommittee, to all stakeholders, to the departments, and then we will continue the discussion on this bill when we reconvene this afternoon. With that completes our work for this morning. We have 10 minutes to get to floor. Please remember, if you have a floor report, bring it today, because we're going to have a lot of bills on the floor today. Take your patience pills, make sure you drink water, and I will see you on the floor. With that, we